Coming up on 9:25. Welcome back, everybody. Ask the Expert continues with Deschenes Poitras Dental Center. You can give us a call, ask your questions, email us, Facebook us, tweet us. You name it. We got it. And welcome back, everybody. So we're ready for our first question. I believe Marcel is on the telephone from Cumberland this morning. Marcel, how are you?
I'm well, and how are you this morning?
Very good, thank you. What's your question today, sir?
I wear dentures, upper and lower.
Yeah.
And in the last couple of weeks, I've started a loud clicking sound in the left jaw.
So right back here? Are you looking at the TV?
I am looking at the TV.
Right back here, Marcel?
I don't see anybody pointing anywhere.
I'm pointing right here.
Oh, yes, right back there in front of the ear. That's correct.
It's me pointing, Marcel. Yeah, thank you, Marcel. I think that's a common problem, The clicking of the jaw, no matter dentures or not.
Yeah. We got to discuss if it is a problem. Okay, number one, clicking. Where does it come from? Okay, I'm going to try not to move this around too much.
Okay, well.
Okay, you got the jaw joint. Yeah. You got this disc between the top and the bottom. You got the ball, the socket. When you open your jaw, everybody does this and it's natural. You see that click back? Yeah. And then come back. So I'll do it again.
You can actually make it happen. Some people can make it happen,
Yeah,
right?
but the sound comes by a misshaped disc, or a compressed disc, or an inflamed disc.
So that little part in the middle here?
Yeah. That little flapping thing here, okay? That's
Marcel, you probably can't reach yours, my friend.
No, please
don't try.
Okay, so that disc is supposed to come off and then come back on. When you open your mouth a bit, it stays, and when you open wide, it clicks. When your denture or your teeth are worn, the pressure on that jaw joint is too much. The disc inflames or is misshapen, and that creates the click.
Would that be a problem too if your dentures didn't fit properly?
Yes.
Yes,
might be a problem.
If they're really worn.
Right. So over time?
Yeah, so it depends on how long he has his denture made of, but we recommend to change it every 5 years, because if the teeth worm down, he's not going to realize it. It's just a slow process. He's just going to get used to.
Right.
And the jaw will be collapsed and compressing a little bit more.
Yeah.
So that's going to create
So all
pressure.
of a sudden this problem would appear.
Yeah. So I would recommend him to go see either his dentist or a denturist to get fit again, to get
probably
just
worm
checked
dentures.
out.
the worm and probably get fuller.
Is that one of the reasons why, as dentists, you often check the bites of people once you do work?
Absolutely.
Like on crowns and root canals.
The individual tooth will have too much pressure.
Right. Because you want it to mirror what it used to look like, right?
And you want it to dissipate on all the teeth.
Yeah, because if it's not the same level or whatever, you're going to have that problem.
That's it. That brings me to the next subject. We heard lots of about children's grinding. Lots of parents came and say, "Oh my gosh, my kids wake me up during the night because he's grinding, and he makes so much noise." Yeah. Well, children, when they change their teeth and go to the mixed dentition, which is baby teeth and adult teeth, they're not comfortable. So what they do, unconsciously, they go and they try to find a comfortable position.
Yeah, even when they're awake and they're asleep, right? This can happen.
Some kids during the day, even when they're awake, but mostly of the time at night, they walk by the room, the parents, and they hear that awful sound, and they're like,
that is a weird sound.
Yes, on the and then they ask her, what can you do with that? And the answer is nothing, because if we put any kind of a night guard or appliance in their mouth, we are restraining their growing part of teeth and jaws.
Yeah, because they don't grow with them.
Right.
So now your jaw's supposed to grow.
So you're constricting the growth as soon as you put that in, especially if you do it every night.
So you got to wait until they're at least 18, 19, done growing, and then you switch into night guards. And night guards are basically
if the habit doesn't, most of the time it will stop, because they will find a comfortable position.
Right.
But if it doesn't go, then that's where we are getting into night guard.
And we're talking about 18, 19 years of age.
Yeah.
Before you can really do anything about it.
Yeah, exactly.
No kidding.
Yeah.
You brought along an example here of what happens, right? And what's the situation here? This is grinding, and they've really it makes me cringe just looking at it, right?
I wouldn't want to do your job every day. You don't want to do my job every day.
Well, there's two types of grinding. There's a grinding associated with position of teeth where the patient is not comfortable. So if one tooth is a little bit higher than the other one, the patient is going to grind through it. There's other patient who's doing it constantly because of their nervous system or stress of life. So they end up like this, using all the teeth, and everything shrinks.
That's teeth that have been ground down.
Yes.
Yeah, that's at least half of the tooth is gone.
Is that an extreme case?
It's pretty close to be. It's
And
very
where are
common.
these teeth?
Worse.
Which teeth are these?
These are the top teeth.
Where?
Top teeth, the middle top teeth. That's
What?
right there.
Yeah.
That's your
These are front teeth.
That's
front
a
teeth.
smile. That's a smile.
And this is the lower one, yeah.
Yeah, we've had some like that.
And then we end up having more serious problem, muscle, jaw joint, because I mean it's restrictive.
Well,
it's,
obviously, this
yeah.
this is about half the size of the teeth, as you say. So that the things we were talking about earlier, right? With the jaw joint,
The
pressure
clicking,
everywhere.
that would change
pain in
everything.
the jaw joint. Exactly.
Yeah. Well, I have some who come and say, "Oh my gosh," and my answer is always, "No, you need some teeth in your mouth
Really?
to open it, to put the muscle the right position."
And that the size of your teeth that over time of grinding or whatever make a big difference in your face.
In
Of
the
course
face.
it would.
Collapsing everything, the lines get
You're
more.
taking-
The line
you're
get
taking-
more accentuated, the muscle more
Sinking in.
Yeah, sinking in. So if
would've
you have the
never thought
right
of that.
length of teeth and the decent positions,
Yeah.
then your muscle will look nice, and well, you'll save a $20,000 facelift.
Yeah, no kidding. Yeah. All right, we're going to take another break. Still another opportunity for you to ask some questions here on Ask the Expert. There's the telephone number, 613-789-6559, extension 2803. Email us, ottawa.morning@ctv.ca, or Facebook a question, tweet one if you like. Deschenes and Poitras Dental Center here this morning to answer your questions on Ask the Expert. It's 9:31. We'll be right back.